Today's topic in sex education is reproduction. We'll be looking at fertilization, implantation, and development within the womb. Terms to know: conception is the same as fertilization. It's the union of an ova and a sperm. Embryo is the same as zygote. It's a developing cluster of cells after fertilization. Fetus, that's the unborn developing baby. Umbilical cord is the cord that transfers nutrients and oxygen from the mother to the fetus. And the umbilical cord is attached to the fetus's body and the placenta. Placenta is the blood, artery, and vein sac connected to the uterine wall where the umbilical cord extends from. Prenatal, it's a time from conception to birth. Ectopic pregnancy is a growth of a zygote in a part of the body other than the uterus. This primarily occurs in the fallopian tubes, and a lot of times it occurs if there's scarring in the fallopian tubes. The fertilized ova will not make its way all the way down to the uterus, and it'll hold up there and develop there. Ectopic pregnancies are usually confirmed by a sonogram and will usually have to be surgically removed. Identical twins, they come from one ova and one sperm, and they'll produce one placenta. We don't know why, but after the one sperm and one ova meet, when they go through their first cell division, they will completely split and then start their cell divisions again. Fraternal twins, they come from two different ova, two different sperm, and they'll form two placenta. With fraternal twins, the female has released more gonadotropin release hormone. Therefore, when she ovulates, two different ova will be released. Since the two different ova are fertilized by two different sperm, in fraternal twins they can be of different sexes. They don't have to be boy-boy, it can be boy-girl. Further examining ovulation, fertilization, and implantation, here of course we have the ovary. The follicle will rupture. When the follicle ruptures, it releases the ova. The remaining cells will form together to form this glandular structure called the corpus luteum. The corpus luteum will release progesterone into the bloodstream, and progesterone will cause the uterine wall, the endometrium, to thicken to prepare itself to accept a fertilized ova, a zygote. As we look, when the ova has been ruptured and goes into the fallopian tubes, fertilization usually occurs in the upper one-third of the fallopian tubes. This is where the sperm usually have to meet the ova, or it will not be developed enough by the time it goes down to the bottom of the fallopian tubes and embeds itself onto the wall of the endometrium. On the way, cell division continues to happen. And when it has a big ball cluster of cells, we call it a morella. And then when it's starting to do some cell differentiation, when it has this hollow fluid in the middle of it, we call it a trophoblast. This trophoblast will, of course, bed on the endometrium wall, and it'll start giving off the hormone HCG, and it'll start to grow a placenta. This diagram here will give you an idea of how long it takes from ovulation to implantation. Again, the zygote is usually fertilized around the first day after you've ovulated. Then, of course, all the cell division happens, and as you see here, about day 8 or 9, the trophoblast will embed itself on the wall of the endometrium. There are 5 ways to determine pregnancy. Number 1, the menstrual cycle stops. Progesterone will continue to be produced during this time, and the HCG hormone will be released, stimulating the growth of the placenta. Thus, you will not shed your lining. 2, there'll be early physical signs. Early physical signs, usually, most women know that by morning sickness, regurgitating, or they feel nausea or fatigued. They'll also find that they'll go to the restroom more frequently, and their breast will begin to enlarge, and their nipples will darken. Then there's an early pregnancy test. This is a test to see if you have HCG hormone in your urine. You can buy these from local grocery stores or Walmart, but you get what you pay for with those. So if you buy a cheap one, it's not going to work as well. Number 4, a physician's diagnosis. It's a test to see if your HCG hormone is in your urine. He's going to mix the chemical directly with your urine. It's the same chemical that's in the pad of the EPT test. This is a little bit more reliable, and we can actually tell whether or not you're pregnant for sure after 6 weeks. 5, an RIA test. This is the best one there is. This is an actual blood test where we're going to look for the HCG hormone in your blood. It can be detected in your blood 5 days prior to your missed cycle. Let's examine embryo and fetal growth. Examining the first 16 weeks of fertilization, on the time graph the purple line represents ovulation. Ovulation usually occurs mid-cycle, which is around 2 weeks for the average person who has a 30-day cycle. The green line represents implantation, which occurs within 8 to 10 days after ovulation. The red line represents the first missed menstrual cycle. As you can see, the zygote has been embedded on the wall of the uterus for approximately a week prior to the first missed menstrual cycle. Looking at continued development from the 16th week to the 24th week, in Illinois, having an abortion is a female's choice up until the 24th week. Then, in order to have one done, a physician must declare it a medical necessity for the mother. At 28 weeks, the fetus is still pretty small. The mother can feel it change positions frequently. With today's technology, there's a good chance for survival if the baby was born prematurely at 28 weeks. Obviously, there are a lot of complications that will have to be dealt with. At 32 weeks, the fetus will move a lot. It is almost doubled in size from last month. The mother may start leaking colostrum from her breast since progesterone levels will be decreasing and will no longer be blocking prolactin. At 36 weeks, the baby is considered close to term. Term is considered 37 weeks. The brain develops rapidly, the lungs are almost fully developed, and the head is usually now positioned down into the pelvis. At the 40th week marks the due date. Pregnancy lasts between 38 weeks and 42 weeks. For safety reasons, if a mother has not went into labor by her 42nd week, the physician will induce labor. Here you see the typical position of the fetus in the later part of the last trimester, with the fetus's head down into the pelvis. The placenta is attached to the mother's uterine wall, where the exchange of blood will take place. The placenta is a blood, artery, and vein sac where the umbilical extends from to the fetus. There are 3 stages of labor. In stage 1, the cervix begins to dilate and oxytocin is released in the bloodstream and the mother begins to have labor contractions. In stage 2, the mother gives birth to the fetus, upon which the umbilical cord will need to be clamped and cut from the placenta. In stage 3, the placenta must be delivered. Here we see the physician supporting the fetus's neck and head during childbirth. Finally, we see the newborn baby, which has been cleaned up and ready to be given to the mother to hold.